Welcome to The Explainer. So today we are talking about asthma. It's something that affects millions of people all over the world. But what does it actually feel like? What's really going on deep inside your lungs? And most importantly, what are the strategies that help people breathe easier? All right, let's jump right in. For most of us, breathing is just something we do. We don't even think about it. But imagine if all of a sudden that simple act became a struggle. That's what it can be like for someone with asthma. It's this terrifying feeling that the air you're trying to pull in is just getting trapped. It turns something so basic into a huge challenge. And this isn't some rare thing. For millions, it's a part of daily life. Okay, so what exactly is this experience we're talking about? Well, it all starts with a pretty clear set of signals from your body. These are what doctors call the classic telltale signs of asthma. These are what experts call the four cardinal symptoms. So first, you've got this nagging cough, and it's often worse at night. Then there's that classic whistling sound when you breathe, that's wheezing. Of course, there's shortness of breath, which can be really scary. And finally, this feeling of tightness, almost like a band is squeezing your chest. Now, you might get just one of these, or you could get the whole shebang. They can pop up and disappear, maybe for a few hours, or they could stick around for days. So what is asthma at its absolute core? Well, it's what's known as a chronic inflammatory disease. Okay, let's unpack that a bit. Chronic just means it's long-term. Inflammatory means the airways inside your lungs are constantly a little bit swollen and irritated. And the reversible part is key. It means that the narrowing of the airways can be fixed with the right treatment. And then there's this big one, bronchial hyperresponsiveness. It's a fancy term, but all it really means is that the airways are super sensitive, kind of on a hair trigger, and they overreact to things that wouldn't bother other people. And this is not a small problem. We're talking about a huge global issue. The World Health Organization estimates around 260 million people have asthma. I mean, think about that number. It's a massive public health challenge, and it doesn't care where you live, how old you are. It affects people everywhere. Okay, so we've got the symptoms down, and we know just how many people this affects. But the big question is, what's actually happening inside someone's lungs when an asthma attack kicks in? Let's go ahead and take a look inside. And this right here shows you everything. So on the left, that's a normal, healthy airway. See how it's nice and open? The muscles are relaxed. Just a little bit of mucus, totally clear. But then look at the right. During an asthma attack, it's a whole different ballgame. The lining is all swollen and inflamed, those muscles are squeezing down tight, and you get all this extra thick mucus just clogging up the works. It's no wonder it's hard to breathe. So this whole process really comes down to three main things, what experts call the key triad. First up is swelling, or inflammation. That's the airway lining getting puffy and irritated. Second, you've got squeezing. That's when the muscles around the airway clamp down, which is called bronchoconstriction. And third, clogging. The airway starts pumping out way too much mucus. It's this perfect storm of swelling, squeezing, and clogging all at once that creates that awful feeling of a trapped breath. All right, so why? What causes the airways to freak out like this in the first place? Why are they so twitchy and overreactive? Let's get into the why behind the wheeze. Well, it's not just one simple thing. It's actually a really complex mix of genetics and your environment. Think of it like this. You've got the genetic hand you're dealt from your family, and then you've got the world you live in. It's that classic combo of nature and nurture working together. And when we talk about those environmental triggers, man, the list is long. It can be anything. We're talking about allergens like dust mites, pollen, or pet dander. It could be irritants in the air like pollution or tobacco smoke. Even something as simple as catching a cold can set it off. For some people, it's just exercising or stepping out into cold air. Basically, each one of these things acts like a false alarm for your body's immune system, which then tells the airways, red alert, overreact, time to get inflamed. Okay, so with so many different triggers and symptoms, and a lot of them look like other breathing problems, how does a doctor actually go from, this sounds like it could be asthma, to, yup, this is definitely asthma? Well, the gold standard test is something called spirometry. It's actually a pretty straightforward lung function test. All you do is take a really deep breath in, and then you blow out as hard and as fast as you possibly can into a little machine. The machine is measuring how much air you can get out, especially in that very first second, to see if there's any blockage, any obstruction in your airways. But here's the really clever part of the test. It's not just about that first blow. After you do it once, they give you a puff of a rescue inhaler, a medicine that opens up the airways. Then you do the test again. And this is the magic number. If your lung function improves by 12% or more after that medicine, bam, that's a huge sign that it's asthma, because it shows the obstruction is reversible. All right, so the diagnosis is confirmed. Now what? Well, the whole focus shifts to managing the condition. And to do that, you absolutely have to understand that there are two totally different types of medication. Think of it like this. On one hand, you've got your reliever medications. People call them rescue inhalers. This is your firefighter. When there's an emergency, when you're having an attack, you use this to get fast relief. It works by relaxing those tight airway muscles right away. But on the other hand, you have your controller medications. This is your fireproofing. You take this every single day, even when you feel perfectly fine, to keep the inflammation down and stop fires from starting in the first place. And this is so important. They are not the same, and you can't swap one for the other. And it's not just about having the right medicines. This quote from a major expert panel really hits the nail on the head. It says that personalized education from a doctor is incredibly powerful, because just taking pills or puffs isn't enough. When people truly understand their asthma, what triggers it, how their meds work, that's when they can really take control. And the proof is in the pudding. Good education literally leads to fewer severe attacks and fewer trips to the hospital. A lot of that education gets boiled down into this really practical tool, an asthma action plan. It's basically a personalized cheat sheet for your asthma. Think of it like a traffic light. The green zone means you're good to go, feeling great. The yellow zone is your caution light. Hey, symptoms are creeping in, it's time to use that rescue inhaler. And then there's the red zone. That means stop. It's a medical alert, you use your reliever, and you get help fast. And all this kind of leaves us with one final big question. We have millions of people living with asthma, and our ability to manage it is better than it's ever been. So what's the real barrier to taking control? Is it the condition itself? Or is it our understanding of it? Maybe, just maybe, the most powerful medicine we have isn't in an inhaler at all. It's knowledge.